welcome back to my corner. I have a very special guest with us today. This is Dr. Meenakshi Bharath, not just my mother, but a fertility specialist. And she's been my rock through everything that we've gone through in terms of my infertility, from understanding the difficulties that we had, to helping us out in her clinic, to then taking us, to wherever we needed to go to get our procedures done, and finally being with me through every step of the IVF that we went through. So I'm going to take this opportunity to bust some of the myths that are there about the IVF process. But we're going to first start with the basis. What does fertility mean?
Fertility to a couple means that they will conceive a baby when they want to conceive it, within a year of trying without any contraception.
So when did you know that for me we had tried and let's move on?
I always knew that you had polycystic ovaries.
Right.
And with polycystic ovaries, there's always a degree of difficulty in getting pregnant. But you cannot actually get pregnant without any assistance. But 4 years after marriage, when you hadn't conceived, then I thought that it was time that we intervene. Otherwise, you had already wanted a baby and it was not coming up.
Right. Okay. Yeah. So that's the basis, that's when we start thinking about what sort of assistance do we need. And one of the common things that they tell us about IVF is it is extremely painful. That's something I was told before the process. And
By others.
And it's not something that was true.
So basically, IVF is, the fear in your mind has to be got rid of. Mm-hmm. If you have the fear, then you are not able to go through it. Mm-hmm. So it's a simple procedure, not complicated, and there is no need to think about it being so painful, so horrible, so full of tension.
Yeah.
No need for all those things. I mean, you understand the procedure and you undergo it.
Correct.
To me, it's as simple as taking tuition. If you need to take tuition to pass your 10th standard exams and you are finding it difficult to do the science and the maths, you just take tuition, do the exams, get through it, and nobody will ever ask you, did you take tuition or not?
Correct. Yeah.
So it's like taking tuition. You take some assistance. Assisted reproductive techniques is exactly that. We provide you with assistance.
So a lot of couples, even though they know they have fertility issues, will still want to try naturally for as long as possible. And what you're saying is that there is only a small degree of assistance that you as a fertility specialist or the whole team in one of these centers would provide. Could you elaborate on that?
Absolutely. So most people will come and say, I still want to try naturally. Now, if you're 25-year-old and you want to try naturally, I won't have any objections to your trying for another 2 years. But if in the 2 years' time you haven't got pregnant, then I think you should stop torturing yourself and go for assistance. So basically it means that you need to take assistance when you reach the stage where I can't get pregnant, I have tried everything normally. Now when we provide you with assistance, we provide you with assistance which is about 10 to 20%. The remaining 80% is very natural. So for IVF, if we are looking at it, if we are going to take you through IVF, the lady has to take maybe 10 to 15 days of injections, and that's about it. One single injection in the first 1 week, and then in the second week there are two injections.
And I can attest that they're not that painful. It's just a quick jab and out, and no swelling, no pain. All of these things that we hear about, absolutely none of that is there. So after injections, then your follicles have grown. Now, if the follicles have to grow,
You could take as many injections as you want, but if the follicles are not receptive to the injections, none will grow.
Yeah.
Or you take the minimum injections and plenty will grow.
Yeah.
With polycystic ovaries, it's an all or none phenomena. So, that's the first place where what you're doing externally, the assistance, is not determining what is the outcome of the number of follicles that are growing.
Correct. And I can give you an example of that, where in the cycle where we were successful, we took minimum dosage of injections, and I had lots of follicles that grew, and then they had to scale back on the injections because my follicles were growing too fast, and that's not something we had seen in previous cycles. So it's not. I would say it's not always in the doctor's hands.
And it's not always in the patient's hands also. So it's in somebody else's hands about.
Totally.
Okay, once that your follicles have grown and are ready for harvesting, wherein you are having the IVF egg collection procedure, you undergo the procedure, but not every follicle will produce an egg. So again, that's not in our hands. That's in somebody else's hands. Not the doctor's hands, not the patient's hands. So that's the next point where it's all natural. Then again, the next, after you've collected the eggs, you don't know whether the eggs are mature or not mature. And that depends only when you see the eggs. So again, that's not in your hands. The eggs are produced and they could be either. If they are immature, they can't be fertilized. If they're mature, they can be fertilized. So the next point after that is then you are putting the sperm around the egg and looking for either natural fertilization, in which case maybe you will have a 40-50% chance of fertilization. But if you are looking at doing intracytoplasmic sperm injection, where when you are picking up one normal sperm and injecting into the egg, then you are getting a better chance of fertilization, which is 80%. So this is injections was one point of intervention, collecting the eggs was the second point of intervention, and the third point of intervention was if you are doing ICSI, you're injecting the sperm into the eggs so that we don't have failure of fertilization to the best of our ability. So that's the third intervention that we do. Again, the next morning, if the eggs have fertilized, then that has happened naturally again, and then the eggs have to divide and multiply. Okay, they have to divide, meaning the egg has to divide, the fertilized egg has to divide into 2, into 4, and then they start multiplying. And so the whole process is again not in anybody's hands.
I remember in one of my cycles that I was all ready for the embryo transfer to happen, and then it was delayed because the embryos that had been pulled out had not divided, and so the new batch had to be pulled out, thawed, and then looked at putting in.
Correct. So there again, it's not in your hands. So therefore, when people come and say, "Oh, I don't want IVF because I want it all natural," please understand how much of it is natural and how much of it is all
not in our hands.
How much of it is not in our hands, which means how much is natural and how much is the assistance that is provided. Very little. I would say most everything is natural.
Another very common worry or myth is that you will land up with multiples, so twins or triplets, when you undergo an IVF.
So it all depends upon how many embryos you put back. If you put back 3 and all the 3 take up, then you have triplets. But we put back 3 for you and only 1 took up.
Correct.
And I'm delighted only 1 took up.
Totally delighted.
Okay, so it's not necessary, and now more or less people put back only 1 embryo so that the chance of having a multiple pregnancy doesn't arise.
The next myth is that egg collection is a major surgery. True or false?
False. Egg collection is a surgery, but it's not major. It usually takes 15-20 minutes in the hands of your skillful doctor. That's about it. They do it very fast, and many places they give you anesthesia. Sometimes they just give you local anesthesia so that you are awake and you don't feel the pain of the needle going in. That's all.
Another myth is that the IVF process takes very long, and for the results to come takes even longer.
So basically everything starts with, nowadays they do what's called a short protocol only, and everything starts with on the second day of your periods.
Okay.
Second or third day of your periods, you start your injections. You need about 10, maximum 12 or 13 days of injections, daily injections. And then you are given an injection to make you ovulate, and that makes the egg collection 2 days later. And then you are waiting for the embryo transfer, which is 3 to 4 days after that. And then you have a 10-day wait for your pregnancy test to come as positive or negative.
Right.
So it's really a 1-month process. I keep telling people, you want to get pregnant, you want to go to a good fertility center, and you have the money, because you need money for IVF. You definitely need money for IVF, and if you can afford it, if you can buy a Seltos car, then you can afford it. Okay, so why go through life not having your own baby if that is what you want? If you want to have a baby with your genetics, this is the way to go ahead and do it.
Okay, the last myth that we're going to talk about is that it is important to rest through the month that you're getting IVF done.
Actually, nothing like that. We don't talk about rest at all. The only time we talk about rest is if your ovaries are very large and you are heading towards hyperstimulation because you're a polycystic ovary patient. That's when we say, don't jump around, don't go dancing, don't go prancing around the place. Just relax, because the ovary is on a very small pedicle, and the ovary can twist, and that can be torsion of the ovary can be very, very painful.
Right.
So that's the only time that we ask you to take it easy. We don't even say rest, lie down and have your,
Only be lying down all the time.
legs flat down and, don't, never. Through pregnancy also, most times we don't recommend that you are resting all the time. That's not good.
Yeah. So resting through the process of IVF, total myth.
Not necessary at all. So those of you who are needing an IVF, go through it without fear. Make sure that you go with a happy attitude, a happy mind and a relaxed mind, and I'm sure that you will go through the process and succeed.
Yeah. And most importantly, don't get stressed out. It is a phase of life that we're going through. There's absolutely nothing to get worried about. I would say take some time off, enjoy yourselves.
Take a holiday.
Take a holiday. Take a holiday. Do things that you've not done in the city that you are in. So that's it from us today from Kanika's Corner. Thank you for watching Amma and me. And
bye. All the best.
Bye.